Good evening, folks. I see we still have many still joining. I'm David Searles. I work at Epilepsy Foundation New England. Thank you so much for joining us this evening for another Wednesday webinar edition. We're grateful for our partnership with Empatica and really excited to have Federica here to present on EpiMonitor. So I just invite everyone to remain on mute to avoid any distractions for our presenter, and also utilize the chat function for any questions that we have throughout the presentation. And as time allows at the end, we'll definitely get to those questions that weren't answered during the presentation. So thank you again for joining. And Federica, thank you so much for joining us this evening and for presenting on EpiMonitor. I know we're all really excited to learn about the latest. So please take it away.
Thank you so much. Thank you, David, and thank you everyone for joining. I will share my screen. Okay, most asked question for a presenter. Can you see my screen?
We got it.
Yes. Okay. I go in video mode. I'm Federica, again, happy to be here and to talk to you about EpiMonitor. A few words to start on Empatica, the company behind the technology. Empatica means empathetic in Italian. It's a spin-off of the MIT with a history of 10 years and headquartered in Boston with an office also in Europe, in Milan, and in Asia, in Seoul, South Korea. And it's pioneering the digital biomarker development and continuous health monitoring driven by AI. We started the company with the idea of being able to monitor patients outside the hospital, patients with chronic condition or with conditions that are difficult to monitor. And we started with neurology with a focus on epilepsy, autism, and stress. And so with this mission in mind and being very much committed to both quality science and quality engineering, we have invested years in research and partnership with the most renowned hospitals, starting with the Boston Children's Hospital at the very beginning, top university, and pharma companies. And we have brought to the market a legacy of medical grade wearable and algorithms that are helping both the patients being supported in everyday life and also the researchers in providing the tools and the technology that allow to advance the understanding, the forecasting, the monitoring, and the treatment of multiple conditions. We're very proud of our hero product, the Embrace, which is the first FDA-cleared smartwatch in neurology that is able to detect epileptic seizures. Among our medical partners and advisor, there's Orin Devinsky, director of the NYU Comprehensive Epilepsy Center, Robert Stiggold, director of the Center of Sleep and Cognition and Harvard Medical Schools, and others. So why is it so important to have continuity in epilepsy monitoring? The traditional seizure monitoring today, as in the hospital, is first of all invasive, very expensive. There's no real time analytics, and it is discontinuous. So not really the best setup for a large population with epilepsy, which amounts to 65 million of people in the world. And 25% of these people that have epilepsy have generalized tonic-clonic seizures, which are most commonly associated with SUDEP. SUDEP is the sudden unexpected death of someone with epilepsy who was otherwise healthy. SUDEP is not much talked about. I guess because it's just so devastating to think about this possibility, but it's important to be aware to help prevent the risk. SUDEP is the leading cause of death in people with uncontrolled seizures, and it's also the leading neurological cause of total years of potential life lost after stroke. Unlike stroke, though, we can help reduce the risk of SUDEP. So it's important to be aware and to spread awareness. There are two ways scientifically being proven to reduce the risk of SUDEP. The first one is adherence to medication and lifestyle factor, so following the doctor's instructions. The second one is prompt first aid that can be guaranteed with the continuity in the monitoring to be able to detect seizures. So immediate assistance is critical. And another important fact to be aware is that SUDEP most often occurs during sleep. And so those living with epilepsy might fear that they'll experience a seizure alone, not having the help around. And so a seizure detection device alerting caregiver if a seizure occurs could help provide them peace of mind. And most of all, can help the person in being repositioned. They can give them rescue medication or calling for medical help and potentially saving their life. And so expediting first response when a seizure occurs can help decrease the likelihood of SUDEP, especially during nocturnal seizures. And many studies have found that SUDEP has been associated with the sleeping position of the individual. So it's really important if somebody can get there, reposition the person and allow it to take that first breath. So the continuity of the monitoring, the importance of the continuity is summarized in these 3 points. It's important to continuously monitor seizure, not just like at the hospital during the visits, because of a higher probability of collecting data during a seizure, because you can capture more seizures. The higher availability of data related to the context of the event, identifying any triggering factor, and to contribute to the knowledge about the pathophysiology of epileptic seizure and SUDEP. And so we have developed our Embrace that can provide continuous monitoring to detect seizures and expedite assistance. The Embrace 2 launched in 2016, FDA clear in 2018 for adults, and in 2019 for children aged 6 and up, is now trusted by thousands of users around the world. And it can detect possible generalized tonic-clonic seizures and automatically alert the caregivers. So the EpiMonitor is the latest generation of our solution for seizure detection and alerting. And with the words of our chief scientist and co-founder, also MIT professor, Rosalind Picard, it opens really an era in giving epilepsy patients greater control over their life. By the way, I suggest also you check out her TED Talk, very touching about how Embrace was born and what a game changer has been for many people. So EpiMonitor is built on the legacy of the award-winning Embrace 2 with even more benefits. Important factor, again, it's FDA cleared for adults and children aged 6 and up. And why is the FDA clearance so important? The clearance process itself for medical devices involves an extensive and independent review of the clinical data that we have submitted, showing that a device is safe and effective, as well as an assessment of testing related to usability and cybersecurity. And so unlike other devices out there that might claim to have similar capabilities, the EpiMonitor has really undergone rigorous validation and testing, demonstrating a level of detection accuracy even beyond the FDA requirements against the gold standard of hospital-based EEG measurements. The EpiMonitor is composed by 2 elements: the Embrace Plus, which is the medical wearable worn by the user, and the EpiMonitor app, which is paired to the wearable and installed in the user phone. So it's being validated inside clinics to be worn in the real world. And the key feature includes the detection of possible generalized tonic-clonic seizures, real-time caregiver alerts, seizure diary and reports, and seizure forecasting study participation. So the EpiMonitor is powered by the latest generation in our wearable called Embrace Plus. And it might look like a fancy smartwatch, but it is in fact a very powerful medical device. It was initially developed as part of project for the US Department of Health and Human Services, NASA project, and US Army's projects. And it features a sophisticated sensor suite, which includes an electrodermal activity sensor, a gyroscope, a temperature sensor, skin temperature sensor, and an accelerometer. The electrodermal activity sensor provides the EDA, also known as galvanic skin response, which I will cover over the next slides. The gyroscope provides data on rotation and angular speed. Temperature provides peripheral temperature or skin temperature, and the accelerometer provides data on motion and orientation. The Embrace Plus is made by comfortable material, is waterproof, is really designed to be worn 24/7 to be an unobtrusive way to collect data for seizure detection and alert, of course, the caregivers. It comes with a USB charger. It takes only 90 minutes to charge, assuming you are starting from zero, but usually people start from a 20% of battery level, and the battery lasts over 7 days. This is an important difference compared to the previous wearable, for which the battery lasted only over 48 hours. And so seizure alerts, the most important feature. It has, again, automatic seizure alerts. You can cancel false alarm. It has self-triggered alerts capabilities. You can adjust the sensing precision. You can temporarily switch off also automated alerts. You can add multiple caregivers to be alerted, and it's suitable for day and night monitoring. So how does it work? You pair the wearable with the app. And once the algorithm detects patterns that resemble a generalized tonic-clonic seizure, it communicates to the app, and the phone via the app dispatched an automatic phone call and SMS to all the caregivers. It has the highest accuracy in the field. Again, this is very important. It has an accuracy of 98% with high sensitivity mode and 94% of low sensitivity. So how we have achieved such a accuracy, such a level of accuracy compared to other solution? The key sensor is the electrodermal activity. It's a key sensor, and we have worked for the last 10 years, mostly with Rosalind Picard's work at the MIT, with the EDA. And again, it's the electrodermal activity, also known as galvanic skin response. For those of you who might not know, the electrodermal activity sensor detects the electrical changes in the skin and gives you an output of the sympathetic nervous system arousal. These data are also important and have been used in studies about depression, anxiety, stress. And so the data from the electrodermal activity sensor in combination with the data from the motion sensors allows to provide this high sensitivity performance and fewer false alarms compared to solutions that only use motion data. So once the EpiMonitor detects a possible seizure, a 15-second countdown begins, within which you can, if it's a false alarm, you can stop it. And so after 15 seconds, caregivers are sent an automatic phone call and SMS, including the wearer's GPS location. The GPS location is another key feature, and we have seen in the last years how it's been a game changer for people with epilepsy. Many users felt for the first time confident of going by themselves to take a walk or go for a run, just because they knew that with the GPS location be received by the caregivers, they could have been located if a seizure occurred. To cancel during the countdown, the user can press the lower side button on the Embrace Plus and then hold and press for 3 seconds either of the two buttons. User can also manually trigger an alert on the Embrace Plus, and to do that, there is a sequence of action. They need to press one of the buttons on the right side and then press again. There will be a question mark appearing, and then they have to long press one of the buttons to confirm the manual alert. And if you change your mind, you can still cancel these self-trigger self-alert. A new introduction with the new iteration is the possibility of adjusting the sensing precision to obviously fit your needs, and depending on which time of day or what are you doing during the day. So the high sensing precision is best adapted for rest time. So when you're sleeping or reading a book on a sofa. The low sensing precision is good for light daily tasks. And you can also decide to switch off completely the automatic alerts. This is if you are in a safe environment, surrounded by the family, friends, people that could provide prompt aid in case of a seizure. But you can still, under this mode, still send self-triggered alerts. On top of the capabilities for seizure detection and alerting, the EpiMonitor keeps track of the user activity, allowing to have better insights on pattern and trends. And so it features a seizure diary, sleep tracking, physical activity tracking pattern, and a PDF export capability that you can share with your doctor. And here you can see a preview on how you can add seizure or review the seizures that have been detected by the system. And you can, again, review automatically the logged seizure, manually add other seizures. You can review confirmed seizures and add additional details. You can view trends. You can generate a report to share with your neurologist, with your doctor. And the image that you see here, you see the time frame of a week, where the blue segments are the sleep periods each day. The green segments or dots are the vigorous physical activity moments. And then in purple, you can see when the seizure detected by the EpiMonitor occurred, and the pink is an example of user-added seizures. And all this goodness of data can also be shared with the doctor to trying to understand together possible patterns and triggers. And so this is an example of reports with the visualization of seizure data, the total seizures in report period, the types of seizures logged, the seizure by time of day, the seizure triggered types, and the daily breakdowns of seizure. And the benefits compared to seizure diary, obviously, they are very clear. Having an automated system, fully mistake-proof in a way. So understanding the trends with your doctor, it's probably the closest point to forecasting, but it's not quite seizure forecasting. Developing a reliable and accurate seizure forecasting algorithm has always been a challenge so far for researchers, because it requires a large amounts of data set, reliable data set. And a large volume of data is important to train, and it's needed to train an algorithm, a reliable algorithm, to achieve an accurate prediction of when someone will have a seizures. And so we have decided to run the first of its kind study to develop a seizure forecasting algorithm using the real world data collected by all the users of our EpiMonitor, obviously anonymously. And so whoever gets the EpiMonitor will be able to access the possibility of being recruited for this seizure forecasting study that will, again, contribute to accelerate the efforts for having an algorithm that will allow in the future to forecast seizure events. This participation is estimated to last 6 to 15 months, but of course users can also drop earlier if they wish. How to get the EpiMonitor? The EpiMonitor can purchase in all US territories through the website, empatica.com/EpiMonitor. The cost is $349 with the enrollment on the seizure forecasting study. And on top of that, there is a monthly subscription for the mobile services covering all the alerts and the cellular data that are used by the system to alert the caregivers. And it starts with $15, $50 and $90 per month. This is a medical device. It's an FDA clear device, and so it requires a prescription, just like for the Embrace 2. A prescription that can be submitted through your account and obviously provided by a healthcare practitioner. And it needs to be uploaded on the system, and then it's reviewed. The review takes no longer than 5 days. And after we receive the prescription, the device is shipped, and you can start using it within minutes. We received a question about possible reimbursement. This is one of the frequently asked questions, and it may be eligible for reimbursement. We have some successful cases. It depends on your insurance plan. So we have a form on our website that your doctor can complete, and you can share then with the insurance provider to obtain the reimbursement. For those of you who own an Embrace 2, the previous generation wearable and solution, you can trade it for the Embrace Plus and receive a code to get $170 off of the purchase in order to upgrade. And in order to do that, you just go on the website, you complete the trade-in form providing the information of your Embrace 2, and then the form will be reviewed. You will receive a trade-in code, and then you just need to follow the instructions to obtain the EpiMonitor. Obviously, it's a new, for those of you again who have the previous wearable, this is a new product, so it requires a separate account and a new subscription and prescription. On the website, you'll find all the instruction on how you will have to cancel the current subscription if you already have one for the Embrace 2, and then start ex novo a new subscription for the Embrace Plus. And obviously, more information are on empatica.com. There is a very thorough support platform within the website where you can find all the information and answers related to topics that concern the pre-purchase phase, one after the purchase, to track down your order, and other questions that can always come up. One of the questions we received was related to the types of seizures that this solution can detect. Now, this solution is optimized and cleared clinically to detect patterns associated with tonic-clonic seizures lasting longer than 20 seconds. So it can detect, as of now, events that do not include movements, such as complex partial seizures and other non-convulsive seizures. But it's always good to talk to your doctor to understand if it's best suited for your case. And in case of children, it's true that the FDA clearance is for children aged 6 and up. However, if your neurologist or doctor see fit for the EpiMonitor for your children's epileptic seizures, it can fill up a subscription for an off-label use. So the EpiMonitor can still be used by children ages 6 and up. And as far as efforts from Empatica, in terms of what's in our roadmap, we are constantly working on new algorithms and pushing the boundaries. And the new challenge is to work on the detection of other types of seizures. And these efforts are conducted by leveraging the photoplethysmogram, which is a sensor that gives you the cardiac related metrics, respiratory rate, SpO2. And so with the use of those data, we are working on developing an algorithm that can detect, for instance, focal onset seizures and other types. So we are excited about what the future capabilities can bring.